Hey everyone, this is Amber Key, and you're listening to a Bright Idea podcast, a show where I sit down with entrepreneurs to discuss the aha moments that launched their businesses. Have you ever left a doctor's appointment wondering why your physician seems so rushed? Maybe they spent more time typing on a computer than making eye contact. Maybe your appointment felt shorter than expected, or you waited weeks just to get in. What if I told you that one of the biggest challenges in healthcare isn't medicine itself? It's everything that happens behind the scenes to keep the medical practice running. On this week's episode, I'm joined by Isabella Brooks, the co-founder and managing partner of LVC Partners, a healthcare consulting firm dedicated to helping medical practices streamline operations, reduce administrative burdens, and create sustainable growth so physicians can focus on what matters most, caring for their patients. Drawing on more than 30 years of combined healthcare experience, Isabella and her co-founder, Shani Reifschlager, partner with practices across the country to solve operational challenges with practical, customized solutions. In this episode, we talked about why so many physicians feel overwhelmed by the business side of medicine, what most patients don't realize happens behind the scenes of a doctor's office, and how entrepreneurship led Isabella and Shani to build a company that's helping healthcare practices and ultimately patient care run more effectively. Before we dive in, if you love what we're doing here at a Bright Idea podcast, help us keep going. You can subscribe to this show to get notifications when new episodes drop. If you like what you hear, share this episode with someone who needs a little inspiration. And if you would like to support the show directly, you can donate to our Cash App at a Bright Idea podcast. Lastly, if you're a business owner or a brand looking to connect with our growing audience, we'd love to collaborate with you. You can sponsor an ad within one of our episodes or sponsor an entire episode. Just reach out to us to learn more. Here's my conversation with Isabella Brooks, founder of LVC Partners. So we have Isabella Brooks, one half of LVC Partners, today here on a Bright Idea podcast. Isabella, how are you today?
I'm well. Thank you so much. I'm so excited to be here, Amber. Thank you.
I am so excited for you to be here too. For the listeners, I just have to give a backstory on how this how this came to be, how this interview came to be. So you and I both work in the healthcare space. You're a consultant for small practices, private practices, and I am in medical sales. And so we were both in a waiting room waiting to see a doctor or make a connection. I was waiting to schedule a lunch, which is usually what I do. And we just kind of struck conversation, and then I found out that you were a founder and that you are really with LVC Partners, that you're a consultant company that's aiming to help medical practices with their operational solutions. And I was just so intrigued by that. One, for the fact that you were like out making cold calls, which is like the sign of an entrepreneur, like life of an entrepreneur, but also that you're like kind of filling a gap and fulfilling a need that I find so much when I go into my doctor's offices and there's so many patients in a room and I'm trying to see a doctor and they're trying to not only diagnose but treat and answer health insurance questions and fill out prior authorizations, all these things, these operations that happen behind the scenes that nobody knows. You are helping to fulfill that need and close that gap. And so I was like, okay, Isabella, you have to come on my show.
It was serendipitous, wasn't it? I made a video just because you have to get on social media. That's how people are connecting. You just don't have a business, or selling, your services, your expertise, you're offering, you're selling yourself. And so my partner and I have really tried this year to get out on social media. And I'm a millennial. Okay. I was born in 92. Like Facebook, 2008, right? All that good stuff, Instagram, but I had not posted on my personal Instagram since December of 2016. Okay. This is 10 years ago. And I had to get back out there. And so in any opportunity to film any content, I actually made a video the second I got to my car after I had met you. And I was like, how wonderful it is that we were just brave enough to be like, what do you do? Like, what are you doing today? And okay, you're cold calling. Okay, yeah, me too. It's such a grind, all that. And I was like, how wonderful was that connection? And I found it's like such a big deal. I'm like, oh my God, just because you're friendly enough to say hi or, have any interest and ask any question. Now look at us. And so I
Yeah.
feel so happy. I'm like,
Yeah.
oh, good. My gift to Gab finally
Yeah.
paid off,
I
right?
know, my gift to Gab, but also, I don't know about you, but being in this space, especially as an entrepreneur and you're cold calling and you're trying to make connections, as much as you have the gift of Gab and you love to connect with people, it really is a lonely experience. I don't know about
Oh,
you, but like my territory is Virginia and Maryland, and like
huge.
a great, it's huge. And so I'm in my car all the time by myself. And so the moment that I find someone in the elevator with me, I'm like, hey, how's your day?
Yeah,
Like,
yeah,
talk to me,
exactly.
please.
Right,
Yeah.
right before I'm like, have all the windshield time in the world and no one's answering my phone calls because everyone's working. And you're
Yeah.
like, okay, well, I guess I'll just listen to music. I mean, there's nothing else I can do. So
I
yeah,
know.
it is lonely. Uh, What's lonely about it, I find the most is, your offering and your vision best.
Mm-hmm.
You can't turn to someone to say, what should the vision be? It's
Mm-hmm.
more of you have to have conviction in what you're trying to accomplish. And I find that part lonely because it starts with the vision. And then, I think a lot of people can say, oh, and then everything else falls into place. No, you have to put it in place. It does not
Yeah.
fall. And you have to find the time to put in place. You have to find the creative place in your mind to then create it to put into place. And then you have to
Right.
execute it. And then,
Absolutely.
it's not, sometimes it can be like, wow, I missed the mark on that one, right? So your
Mm-hmm.
vision could be so clear. And that's why I really envy entrepreneurs who are natural promoters, natural marketers. They just have
Sure.
such a way. It's just like, here's a vision, and I know exactly how I'm going to speak to it and how I'm going to get to there and what I need to get in place. And here's my equation, and boom, boom, boom. And I really envy that because I find, yes, the need is there. It's proven. I know the concept is proven, but there is so much you have to do to put it in, and no one else can help you because they're like, okay, well, what, you can't, no one else can help you build the spirit of what you're trying to accomplish.
Yeah.
Yes, technically, right? Tasks, social media, we have an intern who's helping us with that, and she's fantastic. And so you can delegate those things, but that vision has to exist already. You have
Yeah.
to give the direction. Um, and so I find that that's a little lonely, I think.
Yeah. Yeah,
Yeah.
I think you're really speaking a truth, especially when you, like you said, you have this vision and it doesn't just go with one pitch and then you're done. It's constant. It's trying to persuade someone to believe in your vision, especially with you and your partner with LVC Partners. There's such a need in healthcare, and there's like so many layers within healthcare. And one thing that I didn't realize before talking to you is that I think of my doctors as like, oh, this is my doctor. I go in, I get my checkup, I get my diagnosis or whatever, and then I leave. It's a business. And like if you and the way that it operates is a business. And so it's sort of what you guys are doing is very niche. And so well, it seems niche, but you have to like constantly bring awareness and constantly put it out there that there's such a need for this so that people don't forget about you, and so that can be lonely to your point too.
It can. Or you are bringing up, well, I guess I should start. Firstly, physicians, and where LVC Partners really focuses on are small to medium sized privately owned medical practices. Now, there are plenty of practices who have partnered with healthcare. Um, I don't want to call them firms, but healthcare companies like Privia, right, where
Yeah.
they really centralize operations.
Sure.
They're successful because if they can go to a doctor who owns their own practice, or a group of physicians who they collectively own the practice, and say, look, we can centralize all billing. We can get you on an EMR. We can set all that up for you. We'll take care of your website. And that's just like the very top of what we see. But we handle all of these operations. Any doctor would be like, well, that sounds relieving. That
Yeah.
sounds so relieving. And
Yeah.
so what we have to remember is physicians went to medical school to become physicians,
Hmm.
right? Very rarely do they have a degree in business or a background in business. But to run a doctor's office, it's a business. And
Yeah.
with the business comes operations. And so LVC Partners was founded out of that need um, to become a medical operations consulting firm. 30% of all physicians or medical practices were privately owned.
And I want to get into LVC Partners and what it aims to do and the services that you provide. But I really would love to start this conversation about just this overarching issue, which is the business of healthcare and why it's becoming increasingly difficult, not only for the physician, but and then in turn for the patients. So I want to start by just some statistics that I found through the American Medical Association. And I thought this was interesting, and I would love to know from your perspective when you're going in and doing like your like client needs analysis, for example, like are you finding that this is an issue as well? But what I found was nearly 42% of U.S. physicians reported at least one symptom of burnout in 2025. And although this is an improvement from the pandemic highs, administrative burden, staffing shortages, and workflow challenges remain some of the biggest contributors. And then it also mentioned that it said that the U.S. continues to see fewer physicians choosing independent practices and many joining larger health systems because the operational and financial demands of running a practice have become increasingly difficult too. So it kind of goes to your point of like medium practices using like Privia, for example, where it's like a streamlined workflow.
Right.
But the bigger practices have more money that they can do that. Are you seeing that sort of burnout on your end from speaking to your physicians?
Yeah, of course. And when I was on the healthcare vendor technology side, and that's where my career had started, even at that point, I believe the metric was only 30% of all physicians or medical practices were privately owned. So they were either selling or being absorbed into these large IDNs or healthcare systems. So like, what's that? Inova,
Mm-hmm.
right? So Inova,
MedStar.
MedStar, right? All those, right? They'll, I don't know their operation or their business plan, but they will approach and then say, we want to basically buy you. And that's a relief because the doctor's like, I can continue to practice and I get paid and I don't have to worry about staff and X, Y, and Z and all the things that you had listed that contributed to burnout.
Mm-hmm.
Um, and so I believe, and this was some years ago. I'm sure it's even smaller now. It was about 30% nationwide in the United States. These medical practices were independent, privately owned.
Wow.
And so, yes, does that decrease where LVC can go? Not really. And hopefully, as we grow, we can grow bigger because, you know, these hospital systems are closer to corporations, but in Shani, my partner, and I's experience, we've dealt with large IDNs or these huge hospital systems, right? Multi-specialty, surgery, ambulatory service. I mean, everything under the sun. So we know our way around that, but we find that the operational need and where we can kind of penetrate a little bit easier are these privately owned small to medium sized practices. I mean, we speak with practices, we've spoken with several actually, who have partnered with something like Privia, which is different than like an Inova,
Yeah.
but that centralized operational like offering that they use to sell these physicians on, and they do have freedom. They're not totally owned. I know that some practices will use Privia as an excuse not to maybe meet with us, like, oh, everything is centralized. We're good on operations. It's all taken care of. Some are very happy and content. They do a lot for us. No, we have this program, we have this program. No, that is centralized. No, we don't even touch that. I don't have to worry about it anymore. I have
Right.
peace of mind. That is literally a quote from a physician that we had met with. She was an internal medicine physician. That was from a couple weeks ago. She was like, I just like the peace of mind. I don't have to worry about it. I don't
Mm-hmm.
have to worry about billing. I don't have to worry about the EMR. I don't have to worry about any of that. And I mean, what more could you say? I mean, she just wants to focus on providing care and seeing her patients and completing her notes, and she doesn't have to worry about anything else.
Yeah.
I'm minimizing her day-to-day responsibilities, of course, like any physician, but you don't have to worry about denials. You don't have to worry about an update on a reimbursement from a certain CPT code, right?
Yeah.
That's
Yep.
how these practices are making money, and it gets overwhelming, and that absolutely contributes to that burnout metric
Yeah.
that you shared.
I can definitely. I have seen so many times in the offices that I go into that it's like they just want the peace of mind. They don't care what it is. They just
Right.
can't. They don't have time to, you know, working in pharmaceuticals where you go in and a patient can't get their medication, and the first question is, okay, did you do a prior authorization? And that is like a curse word. They're like, a prior
Right.
authorization. Like, I just need this patient to be well and get their medication. So, you
Right.
know, the business aspect of it, they don't have time. That's not what they went to school for. To your point earlier, yeah, I wanted to know in your experience, like, how much of a physician's day is actually spent running the business instead of practicing medicine.
Yeah, I wish I had the firm metric on that, but unfortunately, I think a lot of providers, um, and when I say providers, I mean MDs or DOs, PAs or physician assistants, nurse practitioners.
Right.
Um, they spend, if the practice is setting such a goal for them to see 20, 21, 23, 24 patients in a day, right? They're going room to room to try to see those patients, right? But a huge part of compliance, which everyone fears compliance because Medicare and majority of all practices are all, partnered with Medicare.
Yeah.
You have to follow compliance, HIPAA compliance and Medicare compliance and regulations if you want to get paid, because those audits are no joke. And I hate to fearmonger, but that is a huge, huge, scary possibility for a
Yeah.
practice. And so these medical notes are what the doctors take home, right?
Mm-hmm.
So they see patients all day from 8:30 to 5:30 or 6, and then they have 20 notes that they have to complete, right? That they didn't get done, right? And then you can imagine the backlog. So you do that 5 days a week for months, right?
Yeah.
And then you have a
Yeah.
huge backlog of notes, and that's just what the provider can do. And so the burden the administrative burden, I would say, I think is the biggest problem for these physician owners. And there are all the things that you had mentioned. So insurance, updating their CAQH, which allows them to be paid by these insurance companies in a very dumbed down definition of it. Documentation, coding, compliance, um, they have to keep the quality up, right? There's EMR documentation. There's also an incredible amount of different vendors out there. And so their EMR, because it was cheaper, might not be the same as their clearinghouse, where they're submitting their claims,
Yeah.
right? And that might be different than their scheduling or their patient communication. And so you have doctors who are in antiquated systems. Like they can't get good data. It's very hard to manage it. They have a practice administrator who does their best, right?
Mm-hmm.
They do their absolute best, and I do have pain for them. They're managing an entire staff. There's high turnover, especially with MAs. There's a
Yeah.
lot of high turnover MAs, front
Sure.
desk receptions, right? I'm sure you know that. They're managing people. They're managing everyone's job, and they're supposed to make sure that there's a 30-day turnaround in collections and
Mm-hmm.
submissions, and denials are being worked. Okay, our denials being worked right in 90 days. Do we have 90 days to do it, or do we have 6 months like Medicare? Is it private payer? Okay, it's only 90 days, right? We have to get it out.
Yeah.
There's so much. And then if a physician owner is doing it on their own, impossible. There's just no way. There's no way. And so then they outsource it, a different vendor, a different vendor, a different vendor. We just met with a dermatology practice, and they said, we have gone down so much in revenue.
Wow.
We have a billing team. I go, okay, it's outsourced? And they said, yes. I go, okay, well, what do you think the difference is? It was tens of thousands of dollars from the previous year. I'm like, well, did you ask them what the problem is? They're like, yeah, they're saying we're getting denials for X. Okay, are they working those denials? Yes. They're saying that our dormant claims are growing. Like, dormant claims? Why are any claims dormant? They're either
Yeah. What
corrected,
does that even mean?
you're,
Yeah.
or you are sending, oh God, it's leaving me. You send like a challenge to the insurance company to say, no, we submitted it correctly. You're behind. Here's our proof, right? So you're working those denials to try to claw back any revenue you can. But if a certain percentage are just going dormant and they're never being worked, then you're missing all those deadlines to then even get reimbursed. And then it's free work. You just did free work. It's too much. At this point, what we have done with these practices that we have done a discovery with or have actually signed contracts with, right? And so a lot of what we do is to prove our expertise is to do a discovery. And the discovery is much better if it's pointed. They know that this is an issue. They don't have the bandwidth. The team doesn't have the capability or the capacity to handle it themselves. We'll say, okay, we'll do a discovery just on that. Or they might just say, we want you to do a general discovery.
Mm-hmm.
Typically, and this is always a surprise to them, and I'll take one as an example. We did a discovery for internal medicine primary care practice. We went in wanting to understand how their remote clinical program was performing. So, and I can explain remote clinical program, but one is like RPM, remote patient monitoring, or chronic care management, CCM. They wanted to know how that remote clinical program was performing. In that, we found and created metrics based on their billing performance. And so, not 10 times out of 10, I'm going to say, whenever we are reporting metrics back to a practice, they're very surprised that that's the actual metric.
Wow.
And so the disconnect between a provider understanding what's going on in their business, not the clinical care portion, but actually the actual business that's paying the bills and paying people, is so stark. And that goes, yes, they might know their top line, they might know their bottom line, right? They will know, like, yes, we are growing at this rate, right? And those things are high level. But like, where are the leaks? And so they don't realize that. And so we had presented these KPIs back that we had found in passing. And they're like, oh, I don't understand how that's happening. And then we always ask, is there anything that we're missing? So we go down an entire list, like, what are all the platforms? What are all the vendors? Who are all the team members who are touching this? Are we missing anything though? Because this is how we collected this data. This is what it's showing us. And they're always shocked. I don't know why we're getting paid 180 days after the claim has been sent out, or I have no idea why we submitted that claim 90 days in the rears. That's crazy.
Yeah.
You have to pay your bills. Another one is going back to clinical programs, which clinical programs are amazing for doctors' offices if they can execute on them. And that is one of our core offerings. If they can execute on a clinical program, it absolutely can free up the doctor's time to see actual sick patients who need attention, who need to be in the office physically, without losing touch on someone with a chronic condition or very high blood pressure, hypertension, anything like that. So it's so good to keep patients safe, but also it's a great revenue stream. It's a great revenue stream that you can count on X coming through every month because you're running this clinical program. We walked into a practice. They're like, oh yeah, we have cardiac remote monitoring. Okay, great. How many patients do you have on? They said, I don't know. I'm going to say, oh, I don't know, maybe 300 or I think 300. I'm like, okay, that's a great amount. I go in, they have 1,000. About 20% of them are dead. 70% of them had never sent any information or data through their remote monitoring process, and they had 31 patients on. That was it. So when I had done the pro forma, I'm like, not only are your patients unsafe right now, incredibly unsafe because they have an implanted cardiac device that has to be monitored, but two, you are leaving, and this was no joke, they were leaving over $120,000 on the table every year.
Yeah.
So I would say at this point of LVC's infancy, people are not banging down our door. We are banging down theirs. But in that process and how we are trying to, I guess, present our expertise,
Yeah.
what we solve, what we accomplish, what we deliver, it's always around how do we keep patients safe? How do we alleviate you? Right? And lastly, how do we make sure that you have visibility and stability in your practice? Because
Yeah.
you don't know what you don't know. You just don't.
Yeah. I mean, what you're speaking towards is so true. And it's like, one, it's on the one end, how much money are you leaving on the table by, running your private practice? At the end of the day, you have to keep the lights on, you have to people to pay, all of the things. But at the end, but also in addition to that, we're talking about healthcare, we're talking about people's lives. And so if you have patients who have a heart monitoring device and you don't know the metrics or how often you're supposed to check on these patients, like that in turn turns into malpractice, and then your business isn't going to last at all. And so I thought about when you were talking, I used to work in neuroscience, and so I would go and speak to some of my providers, and I went to this doctor's office, and I believe it was like 10 or 11 a.m. And I was asking him from the previous time that I spoke with him, how that patient that he had talked to me about the previous time, like how were they doing? And he was like, well, I don't know, I haven't followed up with that patient yet. And I'm like, well, it takes 2 weeks, like the onset of this medication takes 2 weeks, they should start feeling better, we talked about. He's like, well, I've seen 25 patients today. And I looked down at my clock and I said, it's 11 o'clock, Dr. X. Like, how have you seen that many patients? And so it's really sad, and I feel for everybody. I feel for the providers and in addition to the patients. But I was also wondering, these doctors go to school for medicine, they don't go to school for business. And so when you were talking about some of the things that you're asking in this client need analysis, you're essentially, not only are you helping operationally, but you're having them think as a business owner, as an entrepreneur,
Right.
in a way that they may have not or probably hadn't thought about in the past. What are some of the biggest mistakes that you see private
Yeah.
practices make?
Um, a lot of I wouldn't find it a mistake. I don't find it, I can't say it's a mistake just
Okay.
because I have such empathy that they're overwhelmed. But I would say the most shocking things, the most shocking things for someone who is taking care of, has a patient panel of 10,000 patients, right? And they're running a practice. They don't know some of these key performance indicators or these just basic metrics. Days in AR, like how many days in accounts receivable are you sitting at?
And for the listeners who don't know what that is, what is that?
Days in accounts receivable, or are how long does it take you to get paid? Okay, so um you want to keep that really tight, like 30 days. like super tight. And the longer you creep up, the more delayed reimbursement is. And that's the whole reason why they're doing their notes, and they are, taking their work home so that they can create that medical note so that they can drop the bill and then submit the claim. I mean, that's how they get paid. Um, and so just this very simple metric, like days in AR, like what is it, right? The practice manager might know, I think we're in like 32 or we're in 35 days. Like, okay, that's not bad. What's keeping us from getting to 30? And so I think it's the challenge of like, well, 35 is good enough. Well, why can't it be 30?
Mm-hmm.
Well, why can't
Mm-hmm.
we take it from good to great, right? Or their remote clinical programs are underappreciated. I would say that that's a huge mistake.
Mm-hmm.
And they might have, and they've done the work or invested in setting up these clinical programs that are streams of revenue. I mean, really, they really are, and they can be significant. Um, they also, I mean, it's so important for hospital admission prevention, right? Longevity, um, better patient outcomes. Like all these remote clinical programs have proven in one aspect, one of those things I just said. So
Mm-hmm.
they undervalue them or they underappreciate them, they underutilize them. And just simple metrics of, okay, how's that going? It's good. Okay, how many patients are enrolled? I think we have a good amount.
Mm.
Okay, what's the amount? Right? And then they say a number. And oftentimes, the practice administrator is not a PA or a nurse. They are a practice administrator, right? And they don't know really at all either because a nurse and the staff who also is supporting the doctor or an NP who's supporting the doctor or has a patient panel of their own is overseeing that clinical program. And then you find out, okay, you only have 30 patients enrolled, 31 patients enrolled.
Mm-hmm.
Why aren't you pushing it? We
Mm-hmm.
just don't push it a lot. Okay, well, why? Because if you want to have a better day, you want to see less patients a day, these are programs that will allow you to see maybe 14, 15 patients a day, right? You're giving better quality care, you're spending more time, you're able to get all your work done, right? So why are we undervaluing this? And I think because I've talked to plenty of physicians, and one is very near and dear to me. He's like, you have to sell to the practice. You can't sell to me. You
Yeah.
can't sell to the doctor. We don't want any more work. I don't want to have to go over another thing when I am have my 20 minutes with this patient.
Yeah.
I don't want to talk about one more thing. I don't want to try to convince them to
Mm-hmm.
do remote patient monitoring. Okay, well, you're most effective. I can't do one more thing. Get away from me. I can't
Yeah.
do it, right? So then you're having to prove X, Y, and Z. I think that is a huge mistake. And then also I would say um, I would say that they get very comfortable living as they are. They are creatures of habits.
Yes, they
Just as
are.
sure as they went to med school to be doctors, they are creatures of habits. Every physician is. They don't like a lot of change, right?
Yeah. Yeah.
What's wrong with it? Why can't I just keep it this way? No, I don't want to improve, right? And I say they don't want to improve. I don't want to do a big overhaul. A frequent reason I've heard is, look, I'm only going to practice for another 10 years and then I'm done.
Mm-hmm.
10 years is a decade. That's so long.
And so
What do
much
you
change in
mean?
medicine. Yeah.
You know?
Yeah.
So they're very comfortable living where they are, and just basically like clawing their way to like, the end of the day or the finish line or wherever they're wanting to get to. And it's like, it doesn't have to be this way.
Yeah.
It doesn't have to be this way. Okay, but to improve it, do they really want to work doubled hours? They want to work 120 hours then?
Well, I was going to ask, is the issue caused by technology, by staffing, by
Yeah,
finances, or by processes? But it sounds like it's all of it.
it's all of it. You nailed it. It's all of it. There's so many different technologies you can bring. Now there's AIs in the room with you. right?
Yeah.
They'll listen to the conversation. But then I heard a doctor say, um, yes, but then if the way that we program it, although I am not talking to the doctor or to the patient about their diabetes, because this is a wellness check, right? Not like a chronic condition type of appointment. I'm still looking and managing that.
Mm-hmm.
So, but I don't want to ask them about it because I'm going to be in the room for another 30 GD minutes. And I can't spend that much time because I have 18 more patients to see, right? And
Yeah.
it's 11 a.m., right? So then I can only talk to them. And so the AI only listens to what I say. And so, but then I have to go back and I edit it. Now, part of it, I think, are doctors being a little, it's like, yes, but rather than maybe creating the whole note, you adding just a sentence, is that like how much time are we actually
Yeah.
losing there? Like how much time are you actually spending there, right? But
Yeah.
then again, they're at their wits' end. They don't want it. So then it takes them a very long time. Like the running joke in healthcare, and as you know, Amber, is like it moves so slow,
Mm-hmm.
right? It's so slow, and the doctors are so slow to adopt change, right? And so one of the big awakenings when we started LVC is like, holy Toledo, this sales process is so long. Oh my gosh, because you're just massaging, massaging, massaging. Um, because they're not, if they're not comfortable, they're not going to move on. So technology absolutely is one. The administrative burden, absolutely. Vendors, so many options, right?
Mm-hmm.
There, all of it contributes to them just being like, you know what, I can't do it. And I'm gonna
Yeah.
also add capacity and time, correct? But also the capacity and knowledge of their team, themselves and their team,
Mm-hmm. Mm-hmm.
right? Um,
And the time for training. If you don't have time
oh,
to even do the basics and you know, look out for the patient, how do you have time to help
there's
your
just no
administrative
way.
staff? Yeah.
And nothing against practice administrators or billers or anything like that, but if they are looking into maybe getting a new system or a new vendor or a new platform, whatever it might be, especially with technology, you know, these sales reps are really creative. I mean, as we know, I get creative, you know, during my cold calls. Um, but the practice administrators or office managers or whoever, they're not asking these pointed questions, which I think also brings an edge with LVC because we used to work on the vendor side, the
Yeah.
technology and service side. So, you know, you have to ask pointed questions. Well, okay, you say I can integrate. What's the cost? Oh, well, you will cross that bridge when we get there. No, no. What did you charge the last integration? Oh, it's 20,000 and then $3,000 a year to maintain it. What?
No.
Okay, can
Can't do
do
that.
all this. Okay, what's out of the box? Can it do, so that is out of the box. So if we sign on, we get that. Well, no, that's actually a custom build, and so that's going to be an extra X a month. And it's like, right?
And it just contributes to more burnout.
Coming up, Isabella identifies the signs of burnout in medical practices.
I wanted to know too, like, what, when you walk into a practice, what are some warning signs that you see that tell you that this practice is heading towards burnout?
Oh, you know, that's a really good question. Um, it's hard to put your finger on it just because I don't think they're ever going to tell you like I'm burnt out, you know. I don't know if they want to put that foot forward. Um, but I would say like no openness to simple improvements. They're like, no, it just
Mm-hmm.
doesn't make sense. They don't want to bring on uh like there's not a lot of interest in patient growth, patient population growth, or other revenue streams.
Mm.
To me, I don't know if they're burnt out, like they're on their way out, or they're like, I just like that sounds like work.
Yeah.
So things like that, I think show that they're really burnt out and they're like, okay, yeah, that, I mean, yeah, it sounds good. we're not interested right now. And so it's really those things. It's like there's no interest. Like, how's patient growth? And like, I'm actually not trying to get on new patients. Okay, great. How many patients are you seeing a day? 8. I'm like, that's kind of low.
Yeah.
No? Okay, are
Yeah.
you happy with it? If you're happy, I'm happy. Then that's fine. Right? So that's like, so you have to be so balanced because, every doctor only wants to see, like a dozen, 14, 15 patients a day. That's very comfortable. But like, are you able to get to that operationally because you're so efficient and you have
Yeah.
that many providers and everything is so well run? Or like, are you seeing less than that because like you don't have patients coming through the door? Like, where's the retention? So like going back to KPIs, like what's your patient retention? What's your like, have you pulled a report to see which patients you haven't seen in 2 years? Like, okay, COVID's over. We know that there are patients you haven't seen in 3 years during the COVID years. Like, yes, we know. We're out of COVID. How many patients have you not seen that you saw within the last 2 years? Like, what does
Yeah.
that look like?
Yeah.
Very
I love
simple
that.
question. It's very
Yeah.
simple report. I mean, it could be, it's like, it's an appointments report. Literally, get in
Hmm.
your EMR and pull a appointments report for the last 36 months and then see how many are duplicated. I mean, it couldn't, but like, yeah, to me, they're like, okay, well, you're the asshole. You're just going to come in and do it. It's like, well, I could teach you how. I mean, that's
Hmm.
part of it. Like, I don't want to do this the rest of my life for you, but I can teach you how. We
Yeah.
can establish the key metrics that you need to know that your business is healthy.
Yeah. How have you been able to bring back a business to healthy?
Too healthy. Yeah, a lot of it, what we have done is, I would say that what we've done to make them at least a little bit healthier is given them visibility. So, ignorance is bliss. And then when you're not ignorant anymore, you can't ignore it anymore. And so I think the awareness and visibility and making that repeatable for practices has what is what lights a fire for them to get some things in order, right?
Yeah.
Also
Hmm.
making just like key operational changes. Like, you need to let this provider go or this nurse go. You need to let them go. Like, it doesn't make sense business wise.
Wow.
Or
Are you
it's
giving
rarely
that
a,
counsel? Have you given that counsel to different practices if you see that it's like
yes,
a
it wasn't a
specific
nurse.
person?
Nurses are so precious. It was a front desk. Um, and it was like, hey, this is obviously not working out. And I
Hmm.
know it's hard conversation. We'll support you through it.
Hmm.
But if they have this going on and X, Y, and Z, like, we need to, unfortunately, on the business side, you get a little bit more callous with these conversations. You're like, okay, we need to use them to get to this place, and then we need to let them go. We had partnered with an aesthetics practice, um, and they had a esthetician, and she was doing something on the side. And we gave very strong recommendation because all we can do, Amber, is recommend. We can't pull the trigger, right? We don't
That's
hold the
right.
keys to the practice. All we can do is strongly recommend and create an argument for that recommendation. Here are
Hmm.
all the things that can happen. Also, she's very expensive. Why are we keeping her around? The patient volume and the need does not meet like having them here.
Wow.
And so we do give that, and it's tough. Um, But Shani and I, coming from corporate corporate backgrounds and experiencing risks, firing people ourselves, doing, performance improvement plans, right, all that just makes you a little bit more callous to this conversation to say, literally, for your business, it does not make sense. It's a line item you can eliminate. Like, it's a
Yeah.
cost you can eliminate. Why don't we do that?
Yeah. I want to talk a little bit about the patient and tie it back to the patient because
Yeah,
ultimately, that's what
we're
we're
all
here for.
patients, aren't we?
Yeah, Yeah, we are. We're
We
all
all
patients.
are.
We've all experienced sitting in a room for a very long time, or not feeling like sitting in a waiting room for like 30 to 40 minutes only to be seen for 15 minutes by your doctor, and
Yeah.
not feeling like you have had proper care. And ultimately all of the operational consultations that you're doing with these practices are for, at the end of the day, the patient, and to improve the health of the patient. So just for people that are listening that are not in the healthcare field but are patients and looking to you to help these practices solve this problem, like, from what you and your partner are doing, how do solving these operational problems, all of the problems that we've just talked about, how have you seen it affect the patient on the other end in a
Yeah.
positive way?
Yeah, absolutely. Um, I think for patients, and old school physicians will tell you this, and it's also a reason why they won't bring in maybe new AI or new technology into the practice, is because they'll get feedback from patients saying, I went to another primary care doctor and all they did was just type on their computer as I was talking,
Mm-hmm.
right? I know that I value that one-on-one time with my doctor because, um, it takes people maybe a moment to get vulnerable to tell them, like, hey, actually, like, I'm not feeling well about this or whatever it might be. And
Yeah.
so I think the amount of time spent with a patient is pretty powerful. I think that can, a lot of data has shown like a personal connection or X amount of time spent with a physician increases the decreases, I'm sorry, the likelihood of that patient or that physician, excuse me. There's been a lot of studies and data that have shown that a specific amount of time that a doctor can spend with their patients significantly decreases the risk of like being sued for malpractice.
Mm-hmm.
Um, and I believe it. I mean, I love my doctor. I love she's an OBGYN. And she spent 45 minutes with me. I was almost like, hey, I have to get back to work
Yeah.
before like her nurses were banging down her door. But like, ask me if I'll go to another OBGYN. I won't because she took the time and she spent time with me.
Yeah.
And I think ultimately that's what doctors want to do. They want to care for, that's why they became doctors. They want to
Yeah.
care for their patients. And so the solution has to be how do we allow them to spend more time with their patients, but keep the business afloat, right?
Yes.
And so specifically, I don't, I'd be lying if I said this is the key to making that happen. And I also, I'm not a doctor, so I don't want to speak for all physicians, but a lot of the technology and services that come out are to alleviate a lot of these administrative burdens,
Mm-hmm.
right? Taking
Mm-hmm.
notes, AI, scribes, like scribe systems, like all of that is to decrease that amount of time, not for the doctor to be reloaded with like, oh, you can see 3x more patients now a week. Like
Mm-hmm.
that's literally not what they do not want to hear that.
Yeah.
They're like, yeah, I would like to not be 3 weeks behind in medical notes, right? So how do we alleviate the administrative side? And I think that that would free up time for doctors to spend more time with their patients. At least that's what I've gathered with all my conversations with doctors. Okay, and if they need to spend more time with their patients, how are they going to make up that revenue so that they can keep their MAs and front desk and practice managers and nurses and nurse practitioners, right? How do we do that? Um, and there's a lot of things you can do. And two of those are what LVC Partners does. We focus on remote clinical programs and we focus on specifically practice intelligence, business intelligence, so that they know where they are so that we can intervene where they may be leaking. because they don't always know.
Still to come, how LVC Partners is helping medical practices tackle operational challenges so they can focus on patients.
I love that. And I love that you are leading into my next question, which was building LVC Partners. And I really want to talk to you about that piece of it, because that is why we're here today. And I think what's really cool, if you could just go into some of the services that you provide so that the people that are listening, I have audience members that are listening who are not in healthcare right now, but are patients and would love for you to help their practice, with these operational needs so that they can feel like they're being taken care of. But on the other end, there are people that listen to this show that are in the medical field that are feeling strapped and burnt out and don't know where to go in terms of how to keep their business afloat while still helping their patients. And so if you can dive deeper into your business model and what you aim to do, that would be so helpful.
Yeah. So in a tagline, LVC Partners helps medical practices improve performance and their profitability through remote clinical programs, as well as business intelligence. And business intelligence is a very fancy way to say visibility to metrics. Our expertise and what Shani and I have decades of experience in, and where we really built a lot of our career, is remote clinical program optimization strategy, as well as establishment or implementation. And I can dive into that. And then second, we both ended our careers in our corporate type of gigs in operations. And operations is super broad, but specifically for practices, it's practice performance intelligence. So how's the business doing? And as I'd said prior, I'll pull 10 KPIs for practice and say, okay, you're in a primary care or internal medicine practice. I think these 10 are the most important. And 10 out of 10 times the practice is surprised and they find something in those metrics. And again, we asked, did we miss a report? Is there a separate system that this is living in? No? Okay, well then these are your metrics. And here's the benchmark. So, some of your metrics are here. Here's like the bare minimum. Here's the benchmark. We really want to see you here. And then let's talk about it. What interventions then can we do to then improve that number? And then what can we do on a repeatable basis where you don't need us, but we've empowered the team, we've established whatever type of system, operation, additional team members, refocusing team members operationally to make sure that this can continue. And that is for both clinical remote programs, as well as, KPI and business intelligence.
What does the timeline look like for a practice that's looking to work with you?
For remote clinical programs, Shani and I are pretty well versed. I mean, this was like the freshest thing that we had done on the corporate side, on the vendor technology and vendor service side. So we could pretty much get a remote clinical program service line up and running in 30 days. A lot of the stopgap is the practice, right? Again, we don't hold the keys to the castle. We can only make strong recommendations and lay out a timeline. But a lot of times, again, to the point of being overwhelmed, there's decision exhaustion or fatigue. They don't have time to look at the document we sent, which totally fine. I would rather just meet for 15 minutes or have a phone call than read a 2-page document. Like, yeah, stab me with a spoon. I get it. But then it's like, okay, well, when can we meet with you? When can we meet with you? Okay, next week. Okay, week after. Okay, all of a sudden it's been 90 days and we have not implemented.
Wow.
Right? And so I think that is one of the bigger hurdles that Shani and I have run into. And we're finding our power as entrepreneurs and business owners to say, it doesn't seem that you're ready for this. So we're going to stop working with you for this time being. And we're going to revisit you in 30 days. And maybe you will have more bandwidth then. Because I think going from a employee to an entrepreneur, the mindset of jumping from an employee and maybe meeting, like everyone has a boss, everyone has a daddy. And so like my clients are, those are my daddies, everyone has a boss, but being a consultant specifically, you are the expert. You have to, and you have to present your expertise in a certain way. Of course, being honest about your capabilities, being honest about your expertise, I think that goes so far. And that's important to both Shani and I. And it's very, very niche what we are experts in, which makes us really good consultants because it has to be very, very specific. But I think that standing in that power has taken a little bit longer than I expected. And that's just in general entrepreneurship, is not mirroring who's paying you or the client and their habits and how they work, but staying firm and saying, I'm the expert. This is how it needs to be done. These are the success metrics that prove why it's successful and if it's done in this way. And so if you're unable to follow this timeline or make these decisions, or you're failing to understand it, but you won't meet with us, it goes on and on all the way down, then we're just going to have to pause. And when you are ready, we will, but you just let me know when you're ready to maybe take this on, because it doesn't seem that you're ready to take it on yet.
And I think that says a lot about you and Shani's mindset. It's not, because you're really here to help people. And so if after 90 days, if there's no steps being done to make progress, then it's a waste of both of your times, and you want the result, you want to help this business with the results.
Well, exactly. So, and just on the a client services side of just a services economy, right? If they're paying you and they're not seeing a lot of movement or result, they're eventually going to ask, what are we paying you for?
Yeah.
So then you're like, well, we've been trying. It's like, what have you been trying to do? Meet with me? You know what I mean? And you're like,
and they
yes,
don't have time. Yeah.
Right. But then they're like, but we haven't moved the needle. So they don't see themselves being overwhelmed. They don't see the delays that they've caused. It's their business. They're paying the bill. Right. And so that's just, I think, goes along with client services, exchanging services, you're doing services for a fee, things like that. The customer is always right kind of mindset.
Sure. Yeah.
But as a consultant, you don't want to have anyone question your value. And so that's something that Shani and I, we really did learn the hard way. I mean, it was like, what are we even paying you for? Yeah. No, we would not can you show us? And it's like, well, we've actually been waiting on this for 2 months. You've been waiting on this. And it's like, well, then you're the asshole if you're like, well, here are all the emails and outreach attempts, right? So then it's just better. Now we've learned to say, it doesn't seem we're ready. Let's put a pin in it and we'll revisit in 30 days.
Yeah.
Period.
It's life of the entrepreneur.
Yes,
the constant,
sure.
The ups and downs. I want to get into your entrepreneurial journey because when I met you, one thing that I found very fascinating was that you and Shani, before breaking off and starting your own thing, you both have a background in the healthcare space, but in corporate healthcare. And so what made you leave corporate healthcare to start your own company?
Yeah, that's a good question. I would say the simple answer is I worked really hard, and I'm creative, I'm a problem solver, and if I'm going to work that many hours, I can't stand to make a company or anyone else that much money. Why wouldn't I just work that hard for myself? I would say that's maybe more the cocky entrepreneur um, response. That I mean, I'm a little embarrassed to say, pumping myself up to, think that way. And it's true. I mean, um, any company, why wouldn't they? If you're willing to give them 70 hours, why wouldn't they take it? They're not gonna be like,
Yeah.
oh God, I mean, you're approaching 40, you gotta go home, get home, right? They're not gonna
Hmm.
say that. I mean, they're not gonna say that, period. So if anyone's out there like giving, your corporate job 60, 65, 70 hours, I mean, they're gonna take it. And then they're gonna be
Hmm.
like, and I want some more, please. Um, when I had started in corporate, I really did grow throughout um, the previous company I was at, and I was able to do so many things, which I was so grateful for because I was able to gain so many tools in my toolkit. I mean, it was really amazing. In such a short amount of time, I just totally exploded in terms of like learning and my abilities and skill sets. Like it really was incredible. Um, but I would say my more vulnerable answer as to why I got out of it personally was because I was super unhealthy, mentally, physically, emotionally. Um, I really identified my self-worth with the success at the job, how many hours I could possibly work, how many people I could possibly manage, how many emails I could possibly send, 12, Teams calls a day, no problem. And then let me work from 6 to 11:30, what I was supposed to do that day. And
Hmm.
that's totally fine. Um, and to be really honest, it was affecting my relationship. It was affecting my personal relationship. It was affecting my relationship with my family and also with myself. And I didn't talk myself into, it was just like I just identified so much with my
Yeah.
worth at my job that I got into this like creative freeze or like a ceiling mentality that like I can't do anything else. I know everything about this. I know every single thing. And it was like a ceiling where it's like you can't possibly apply this anywhere else. It's too niche. Um, you do so much. And there was also like a total lack of ability to regurgitate it and apply it. Like I think towards the end I was like, oh, I put together my resume as you do. I was encouraged to put together a resume, just because like it's empowering. It's an empowering exercise to then
Yeah.
write it all down, maybe send a few out. You don't feel like so trapped in that.
Hmm.
Um, but I really was just unhealthy. I was unhealthy. My body was unhealthy. My mind, my spirit, everything it was rotted. It was rotted is like a good word to say. And so, if I had to redo it, I might have been able to realizing that everything is going to be successful and okay. I might have worked harder to compartmentalize and separate myself. But I completely felt that LVC had no chance if I was still in that mindset. So I
So you started
just,
LVC while you were working full time?
no, no.
Oh,
And
good, good, good.
I don't know. I hope I don't get in trouble for saying this. I should have, but I didn't. Shani and I both working at separate companies, but doing in the same industry. Um, we both felt very strongly that, okay, we're getting a salary, all these benefits, paid well. We really should give it our all and not, um, and I don't know why there was such loyalty on my side, at least. But I just felt, I wanted to do everything completely and correctly so that there was no bridge ever burned. There's nothing that could come back to me. Um,
Hmm.
but even just like on a personal, like in a mental state kind of way, I could not pick up LVC if I was doing something else because I was just so trapped. I was
Yeah.
so trapped in my own doing, and it's so silly to think about. It's so silly. But like if if you are blocked in that way, or you feel trapped in that way, or you don't feel that anything is possible outside of that, I mean, how do you
Mm-hmm.
create? You just can't.
You can't.
And so, and it feels helpless. I think that's the problem, is that it feels so helpless. And everyone tells you it's not. Oh my God, you could do anything. Oh my God, go get a VP position. You could do this. Oh my God, they'd be so happy. Like, and you just feel, no, I can't.
Mm-hmm.
And it's very, very unique. I think having an entrepreneur mindset, I'm also the oldest of four. Um, I feel that I'm brave and adventurous, and I'm typically very confident. To have the thoughts of like, I can't, I think was so helpless. And it was kind of the bells to say, it's time. Like,
Yeah.
who are you? Like, who are
Yeah.
you? Yeah.
I love that. Thank you for sharing that.
Yeah.
I really love these are the parts about entrepreneurship that people don't see and they don't
Yeah.
share. And so there's so many people out there that are thinking and have like a bright idea just like you and Shani did have, but are not willing to take that risk because they may feel stuck in probably in the same situation that you were. If someone wants to leave corporate America to start a consulting company like you and Shani have, or anything else, like what advice would you give them today?
You already won because you started. I would say you already won because you started. I mean, it's
Mm-hmm.
just so many people don't even start. They don't even form an LLC. You can form an LLC. It's literally a couple $100s, and all of a sudden you have an LLC. Use your resources. So one is you're already a winner because you took a step just to create an LLC, okay? My second is you've got to be resourceful. I felt that my creativity and resourcefulness and being creative in using resources um, was stifled because I had some like whiplash from my mindset at my prior job
Mm-hmm.
in corporate. So um, I would say that you got to be resourceful and be creative with it. You don't need to hire like the best web designer. No one's going to be looking at your website. Okay, get your offering down. Do
Mm-hmm.
those types of things. You don't need a Microsoft Office suite. Just use the Google free one. It's
Yep.
fine. It's totally
Yep.
fine. So just like be resourceful. Um, there's so many resources online. There's so many videos. Um, even for your LLC. I mean, AI can do a lot of checklisting for you. Okay, the
Yep.
first time I ever used any AI was like probably a year ago. Like, why? I could have easily gone a checklist of everything I needed to do. So I would say
Yeah.
be creative in your resourcefulness.
Yeah.
And then I would say the last thing is, and like this is nothing new, but like it's nothing new. It's so much more work than you ever imagined. And I think something that if you are thinking of being an entrepreneur and you're a person of action, so I'm a person of action, I feel that if I am not almost physically doing something, that I'm not moving the needle. Um, I would say that you just need to have some grace with yourself because it is so hard and you're
Yeah.
creating everything. Creation takes a long time, takes so long, and you rework it and then you rework it again and you're like that sucks, and no one understands that. You rework it again, all that takes so much time. And just because maybe you were only at the computer for 4 hours that day, right, when you weren't out there making cold calls or doing strategic partnerships or networking or whatever it might be, posting on social media,
Yeah.
um, you have to give yourself the space um, to rest because you're not really resting. You're going to be thinking about your business. And I would
Yeah.
say that is probably why it's so hard, or not so hard, so much harder than I imagined.
Mm-hmm.
Because it's like, okay, how did I actually move the needle today? All of that happened in my head for the last 8 hours. I've been working in my own mind. Like that's so crazy. And like, oh my God, it's not productive and da 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 da. But like creation takes time,
It does.
and you have to give yourself the space and the grace to be able to create. I mean, because when it's genuine and you believe in it, people will come. And whatever your target is, they will come.
Such good advice. Thank you, Isabella. I want to let you go, but before I let you go, it wouldn't be a bright idea without a lightning round or a rapid fire. So
Oh
would you
gosh.
mind playing a game with me real
Sure,
quick?
sure.
Okay, these are quick questions. So, what's the biggest myth about healthcare?
I'm supposed to answer really fast,
Or take your time. It does, yeah, they should be quick.
but that paper charts are better than electronic medical records.
That's a good one. Okay, what's the biggest waste of time inside of a medical practice?
Probably all the systems that a practice has to log into. Also, no, the biggest waste of time is redoing your intake forms. That is the biggest waste of time. And also, what are you going to do with that piece of paper? Are you going to you're going to scan it in to the EMR and then manually plug it in into the like fields in the EMR? That's so crazy. Let's advance. Why don't you give me an iPad? Why don't you just ask me to confirm that information? This is
Yeah,
nuts. Yeah.
yeah.
Paper intake forms, absolutely. Biggest waste of
So you're
time.
talking about whenever we're waiting in the patient in the waiting room and they have us with the clipboard filling out everything and then the nurse takes you into the room and asks you the same questions. Are you referring to that?
Well, I'm referring to that, but also every time you go in, they have you fill out the same
The same
forms.
thing. Okay.
Just not much has changed in 11 months, okay? Just like give me, like say, here's all your information. Can you confirm all of it? Change anything that is incorrect. And then isn't that immediately connected to my patient chart so that when the MA or the nurse is talking to me, having me confirm again verbally, which is still a waste of time, why isn't that just populated? I think that's nuts. I think
I
repeat,
didn't think about that. That's so true.
it is, and it's unnecessary. I mean, think how much shorter of a time you would be there. I think it might be a ploy to give the doctors more time. Have you fill out those forms again? Shani,
Probably.
Shani is so gangster with it. She'll put on every form, see previous form in my chart. She does not play. She does not play.
Oh my God, that's hilarious. Okay, what is one thing every physician wishes that patients understood?
How many people it takes to take care of them. I think there'd be a little bit more understanding on the patient side.
Oh, for sure. I love that. Um, One thing every private practice should start doing.
Remote clinical programs.
Okay. Can you explain what those are again, just for
Yep,
listeners?
sorry.
No, you're okay.
I would say remote clinical programs, they are an incredible way to keep patients safe. I It relieves burden to see so many patients because you are prioritizing the patients who are very like who are actually sick who need your attention, medication changes, medication adjustments, testing, right? You're spending more time with the patients who actually need those in-clinic services and need to be seen by the doctor. Healthy status quo patients, you still have a high touch with them. You still have visibility to all their metrics, their health data, um, but you don't have to see them, right? And then the older that these patients get, the less care they might have around them, the less they have
Yeah,
to come in and see you, right? If you have a
right.
chronic condition, you have to be seen every 3 months. Imagine a 96-year-old having to get out and do that every 3 months. It's too much. It's too much.
It's too
And also
much.
they're an incredible way to keep patients safe, have high visibility for patients, but also another revenue stream, an incredible revenue stream that if it is implemented correctly can be a huge driver in terms of revenue for a medical practice.
I love that. What is your favorite productivity habit?
Yes. Okay. If I need to do something and I find myself stalling, like getting out of bed in the morning, for example, and there's not a meeting, right? I had said I'm a patient of, or a patient. I am a patient, a person of action. Um, I will count down from 5 in my head, and when I get to 1, I have to start whatever I'm
Oh,
doing.
I'm
So
gonna
if
try
it's
that.
in bed in the morning, I'll just start, count down from 5. The second I hit 1, it's like gun to my head. I have to wake up, or I'm doing something else and I need to really work on this. I will count down from 5. When I hit 1, I have to pivot no matter where I stopped. Like I just have to pivot.
That's amazing. I'm actually going to try that.
Yeah,
That's a
try
good
it.
one. Okay, here's my last one. What's one trend in healthcare that you're excited about?
I love the AI scribe. I love the AI that can be in the room with you and your doctor, and you get to talk to your doctor to their face without them maybe jotting something down constantly or typing on their computer, which is a huge complaint. I understand, right? But if I'm able to have a conversation with my doc and they're able to spend a good 20 minutes with me,
Yeah.
and then that's done for them on the back end, maybe with, like I said prior, maybe a little bit of adjusting. I love that. I love the AI scribing. I think that would be amazing. I mean, it's in one step up from a doctor holding a microphone, right? And just
Yeah.
speaking into the chart. Like,
Very true.
and it's just going to get better and better. So why not adopt it? I mean, eventually the kinks are going to be worked out. And so that's my, you know, that's my rub with healthcare. Like, why is it takes so long to adopt? There's so much good technology out there. There's people who really are
Yeah.
trying to do big things. I love the AI scribe. I think that's great. A little microphone in the room doesn't bother me.
That's awesome. Yeah, let's get with the times.
Yeah.
Isabella, this was so fun. Thank you for coming on to A Bright Idea and really sharing your knowledge and the behind the scenes of what happens with a practice, and like just sharing like your background and how you got into this space. And I'm just so glad that I met you in that doctor's office a few
I
weeks ago.
know, I know. It was yes, I feel that it was fate. And so I
Yes.
thank you so much, Amber. You've been such a gracious host and made me feel so
Oh.
comfortable. Um, I know I present pretty gregarious, but sometimes I get a little shy, and you've made it very, very easy. Thank you so very much.
No, this was great. And I feel like when you're passionate about something and that you're like living in your purpose, this is exactly it. It's easy.
It's
It comes
easy.
out naturally. The last thing I want to ask you is how can people find you if they would like to work with you?
Yes, thank you. So to contact us, you can email info@lvconsults.com. We're also on Instagram, LVC Partners. Um, we're trying our best with the social media. Also, lvconsults.com is the website. You can click on the contact link, fill out a little form. But we're also on Google. If you Google us, our phone number's there. You can call anytime. We'd love to hear from anyone interested in growing your medical practice, creating stability and control. You're interested in remote clinical programs, all of it. We'd love to chat.
I love that. Thank you so much, Isabella. And I will put all of the contact information in the description in this episode. So thank you so much for your time and best of luck with your business.
Thank you so much. Right. Bye, Amber.
That's it for this week's episode of A Bright Idea podcast. This week's episode featured Isabella Brooks, co-founder of LVC Partners. If you would like to learn more about LVC Partners, you can go to their website at lvconsults.com. If you enjoyed today's episode, don't forget to subscribe and leave us a review. Your feedback helps us bring on more stories like Shani's and Isabella's. Be sure to follow us on Instagram at A Bright Idea Podcast for updates, and if there's a topic or a guest you'd like to hear from next, drop us a message. You can donate to our Cash App at A Bright Idea Podcast. This episode was edited by Quincy Tucker. Until next time, I'm Amber Key.